and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You are listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. I'm your host, Dr. David Scharf. Tonight we're going to have a great show. We have a great guest tonight, Dr. Jim Woltman. Jim, welcome to the show.
Thank you.
For those of you who may not know Dr. Woltman, he is a member of the premier dental practice in Massapequa and probably on the South Shore. Jim, before we get started, or as we get started, maybe just tell us a little bit about where your practice is located and what your practice is like.
Yeah, we practice in Massapequa off of Broadway. We got a really great family practice with a cosmetic focus. It's myself and my two partners, and we have another associate who works for us as well. So there's 4 practicing dentists that are there. We're open 6 days a week, so our office hours are pretty accommodating to most. And
it's one of the oldest practices in Long Island, in Massapequa, I think. How old is your practice?
It is. It's 32 years old.
Wow.
It started with Dr. Pashkas 32 years ago, and the location has just moved across the street, and it's really a great place.
I tell you, one thing that always impressed me about your practice, and this is pretty rare, is that it's a group of dentists practicing together that actually like and respect each other. And I always get that feeling when I'm in your office of just the camaraderie there and how much you all respect each other.
We do, and it's we're all close friends, and we're close professionally, and it's great working in an environment where we can throw things off each other and really work well to serve the patient's best interests.
Yep. So I know you're from the South Shore. Where'd you grow up and where'd you go to school?
I grew up in West Islip, and I went to West Islip High School. Upon graduating there, I went to Boston College.
And where'd you go to dental school?
I went to Tufts University.
Yeah.
And I didn't want to leave Boston. It was a great city, so I decided to stay up in Boston, and I went to another great school. So.
Very good. And how old were you when you knew you wanted to be a dentist? How did you end up making that decision?
I was probably, I guess, about 8 or 9 years of age. My uncle was a dentist. He actually practiced in West Babylon area, and every time I went to the dentist, it was always a fun show. He took out all the bells and whistles, and we were able to go about his office, and it was like it was like an exercise, that half hour, 45 minutes when I used to go twice a year. So it was a great time. And he really enjoyed practicing dentistry, and it really demonstrated and sort of followed in his footsteps, I guess.
You know, I've interviewed so many dentists with the radio show, and I can't tell you how many have a similar story that at a very young age they knew that it was the right profession for them. So after dental school, I know we were talking before the show, you did quite a bit of advanced training as well. Tell our listeners about your the residency that you did after dental school.
Yeah, I did a one-year general practice residency at Nassau County Medical Center in East Meadow.
And what is that? A lot of the listeners don't exactly know what that entails and why people would do that.
Yeah, it's well, after you graduate dental school, you are licensed to be a dentist, and you can come out directly from dental school. I chose to spend another year to advance myself and my skill sets so that I can do more complicated cases and more involved cases. So we had a lot of surgical experience there at the medical center. We dealt with a lot of bigger cases, both on a cosmetic realm and also on a reconstructive realm as well. So it was another year in which we can really advance ourselves over and above what we learned in dental school.
And you didn't stop then. I know you were telling me again that you've done 3 pretty advanced trainings even beyond the residency. So maybe tell our listeners about those.
Yeah, when I was in the medical center, I had a big interest in orthodontics. So I enrolled myself in a 2-year post-grad ortho program, which we would go down. It was a 5-day program every 3 weeks, where I'd take a week off of work, and I would fly around to Florida to take this course. And I learned how to do orthodontics that would apply to a general practitioner. So a lot of the cases that we would try and set up for, cosmetics and things, we do some orthodontic alignment on some teeth, and it was a great skill set to learn in order to advance the needs of my patients.
Well, very few GPs do their own orthodontics. Isn't that right?
That's correct, yeah. Yeah, and this was brackets and bands, traditional type ortho, as well as Invisalign type orthodontics as well.
Wow. We're going to talk about the Invisalign in a couple of minutes. But then you didn't stop there. You took 2 more programs as well. I think that's amazing. So tell our listeners about those as well.
Yeah, I also took some courses down. Most listeners won't know the Pankey or Dawson Institute. They're two advanced occlusion style courses that are meant for dentists to advance their skill set and to really to learn how to do more difficult cases predictably, so that you can get to the desired end result without any problems along the way. And patients really who are struggling can come into you, and you really have a set plan as far as how to proceed and know what the potential hurdles are beforehand. So,
again, I think our listeners don't really realize, it's like you said, these are not things that the average dentist does. The average dentist finishes 4 years of dental school and they're turned loose on an unsuspecting population. But between the residency, the ortho program, and especially Pankey and Dawson, I mean, I just have to tell our listeners that these programs take dentists to the top of the top level in their really knowledge set and an ability not just to do the case, but to do the case in a predictable manner. So you know before you start where you're going to finish. And I really commend you for taking the time out of the office, the cost of the course, the time out of the office, and really to bring that level of care to your patients, because very, very few dentists ever do that. So
yeah, thank you.
Good for you.
It's a big commitment,
for you.
But I enjoy it.
Yeah, it sounds like you enjoy these complicated cases, these cases that are involved.
Yeah, I do, and it's a lot of fun. You have an opportunity to help patients who have been to other offices where they weren't able to get what they needed to get to in order to either achieve health or whether it be discomfort and whatnot, and you're able to help people and really change their lives. So it's quite rewarding.
Do you see a lot of patients come in that maybe the dentistry they had in their previous dentist's office, the dentist maybe got in over his head and kind of got out of the case with his, luck, got out of the case, but maybe got in a little bit over his head?
We do see cases like that sometimes from time to time. And a lot of times they're referred to us by the specialists that we work with because they know what type of dentistry we provide to our patients. So we do see cases like that, and it's an attribute to ourselves and the education that we have that we can get these patients back onto a path of success where they're not feeling any discomfort and pain, which is not a nice thing when it comes to your dentistry.
Yeah. I think people are finally starting to realize that choosing a dentist isn't a commodity. For years people would spend more time choosing who's going to cut their hair than just the dentist, assuming all dentists are the same. But I think people are finally starting to come around and appreciate that a practice like yours, it's really a cut above in terms of what you offer people and the skill set that you bring to the table, which most offices don't.
Yeah, it's we try go over and above for all of our patients. We want to welcome everybody as if they're walking into their own home. We don't want them to feel uncomfortable. We want them to be able to pose any questions to us. And it comes across, from the first person that greets you when you walk into our office. We have a fabulous staff. We're like one giant family, essentially. And patients always say, you're like the happiest people on earth. I don't know what you guys have pumping through the air here. So everyone's really excited about their job. We believe passionately in what we do and our ability to help individuals, and it's really a great place.
Yeah.
And in a town with we have 69 dentists.
Is that right?
In our town, so it's there's a massive amount of options that patients have as far as dentists, and we just it's great to see that patients continue to flock to us.
Let's talk a little bit about cosmetic dentistry or these big reconstructive cases that it sounds like you like to do. So who's the typical patient that you see that comes in for this type of treatment?
Cosmetics, that's a great question. Cosmetics can be, my youngest cosmetic patient was probably a 12-year-old boy who, during a playground incident, ran into a fence pole and he broke his two front teeth, and we were forced to just do some minimal aesthetics. It was just two veneers on his two front teeth. All the way up to my oldest patient was 84 years of age, where we did a bunch of laminates or veneers on that patient. So there's not a particular individual, and cosmetic dentistry can be something as minimal as a bonding procedure, just some recontouring where we just level the teeth a little bit just to whatever the patient's looking for. It's subjective. It's not what I like or what the lab tech likes. It's really what my patient wants and what their desires are. So
when these people come in, how does the conversation usually start? Like you said, it's a wide range of things, from maybe a total makeover to a little chip. I mean, how does that dialogue get started?
When you come to our office, first and foremost, you're greeted by our front desk staff, and they take you into our system and introduce you to the entire staff and give you a walking tour of our office. After that point, I enter the consultation room, where I try and learn more about the patient, what their needs are and what their desires are, what their past experience have been, what some of their goals are for their dental health. And then from there, we try and establish what would be best for them as far as what we're going to do as far as our exam's concerned. So every patient we address differently because everybody has different concerns.
I just want to clarify what you said, because for most people, their experience at a new dentist is they make an appointment, they walk in, they sign the clipboard, have a seat, come back, the hygienist sees them, takes some x-rays, the dentist comes in, pokes around a little bit, you need 2 fillings, see you later. But really in your office, it sounds like it starts more with a dialogue and getting to know the patient and some conversation.
It does. And, I call all my patients the night prior to their initial exams just to introduce myself, just to establish that connection with them. A lot of times patients are nervous about coming to a dental office for the first time, so we try and break that ice by giving in, a call that evening prior, and that seems to work quite a bit. And then from there, that just sitting down and getting to know somebody.
It's a whole different experience.
Yeah, it really is amazing.
It's a whole different experience. So where do most of your patients come from that come to your practice?
Most of our patients come from our existing patients. They're either referred from family, friends, or other loved ones that have had dentistry done in our office. And that's how we get about 70%, 80% of all of our patients. So, we treat everybody the way we want to be treated, and then ultimately patients, they flock to us from their family and friends who have received such great care.
Let's talk about that gentleman who was, I assumed it was a gentleman who was 84 who had laminates done. How did that come about? Was this a redo? Was it he just has been waiting, 84 years to do his teeth? And how did that come about?
He actually had a complicated case where he had a bunch of crowns in the back of his mouth, and he had some old failing bondings in the front of his mouth. And his wife, or his daughter, actually had some dentistry done by me, or I had done a cosmetic case on his daughter. And his family had urged him to come meet me. And he was really a great, great, great guy. And we changed over his front 6 teeth with some veneers. He had really unsightly, stained out teeth over time, and his smile is unbelievable. And he told me when we got finished that it was something that didn't come from himself. His family drove him to me, but it was the best thing that he ever had done. So
is that right?
It was really rewarding.
Do people typically say after they finally do their case, what do they typically say?
The biggest thing that happens, when the cases go in, it's really an amazing time for both the patient and the doctor and myself and my assistant and the rest of my staff. What we see a lot of times is patients just break down in tears. They can't believe the results that they get, and when it first happened, when the first patient first cried, I really got nervous. I didn't know if she was happy or upset, but it's a real common emotion. Patients just really let loose and melt down, and they're overcome with joy about how gorgeous their teeth look, and it really transforms the way they carry themselves and their demeanor.
What kind of changes do you see in people? Do you ever see them come back 3 or 6 months later and their personalities are different?
Yeah, they're a lot more confident. I've seen patients who have had, they've moved up in the workforce. They've become more vocal. Just the way in which they present themselves and they carry themselves. They have a lot more, their self-esteem has been risen to such a level.
Mm-hmm. I was talking with a guest another week on the show, and he said that he's actually seen an uptick in unemployed people fixing their teeth because they want that edge in the workplace, that it's not a frivolous thing, but they want that confidence and that edge so they feel better. Have you seen that as well?
Yeah, I have. And, the first thing you recognize when you see somebody is their smile. At least I do. Mm-hmm. And I know most people do. So
every survey you read says the smile's the #1 thing.
It is.
People look at. Do you ever see people who, they have a nice car, they have a nice pocketbook, nice jewelry, they're dressed to the nines, and their teeth don't match with everything else, the rest of it?
Yeah, and, I always ask myself, why doesn't that person just, sit down and address their dental needs? And it comes down to some people, they know they have a need for it, but they're afraid to ask a lot of times. They're embarrassed to ask.
What do you think are some of the biggest things that keep people from coming to the dentist to get rid of these problems that are holding them back?
I think that the biggest thing is a fear. They don't understand what it entails, and they don't have an idea as far as how we go about changing their smile or enhancing their dental health. And fear is the biggest factor, I would think.
Fear of the unknown.
Exactly.
Well, we're going to take a little break for a couple seconds, and then when we come back, we're going to talk about what the process is like when someone comes into your office.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. I'm Dr. David Scharf. You're listening to Healthy Living Radio on WGBB, and we're talking tonight with Dr. Jim Woltman. Jim's a family dentist in Massapequa, New York, one of the oldest practices in Massapequa, and really the premier practice in Massapequa. So before the break, we started to talk about, since these cosmetic things are so, they affect people so greatly in terms of how their confidence or how they look or how they feel about themselves. And we started to talk a little bit about maybe why wouldn't everyone just come in and take care of it? And you said fear was maybe the number one reason. So let's take our listeners through the whole process maybe. I'm home, I'm listening to this radio show. That's it. I decided I'm going to replace my 2 missing front teeth, and I call up your office. Take me through the whole process from my first call till my beautiful teeth go in.
Yeah, during your first call, you'd be greeted by one of our great staff members, and they'll sort of give you an idea as far as what your first appointment's going to entail. So your initial examination in our office is about an hour and a half, and the biggest thing patients say is an hour and a half. Wow, that's a really long period of time.
And that's just for the examination?
It's just for the examination. Mm-hmm. Yeah, your first appointment in our office is with with one of the doctors. Mm-hmm. And then at that point, we make our assessment as far as what needs to be done. So in that hour and a half time, the first 15 minutes, it's a matter of myself and the patient getting to know each other, just finding out what their needs are, what their desires are, what their goals are. From there, we take a full set of digital films. All our films in our office are all digital. The radiation exposure is extremely minimal, and the clarity and resolution is phenomenal. We take a series of models of your teeth. Mm-hmm. We take impressions where we take upper and lower models, so we can mount your case on what's called an articulator, which is a virtual machine that we can use to make your jaw movements occur. We take a series of intraoral photographs, which are probably the most amazing thing that patients really haven't experienced. It gives them an opportunity to see what their teeth look like and what we see as dentists or hygienists and assistants. So that's really the biggest eye-opener that most patients tend to see.
And so after you do all that, do you sit with that person at that visit and explain to them what's going on in their mouth? Do they usually come back? How does that work?
Yeah, we normally give them an idea as far as what we see and what we're thinking, and see if that's along the lines of what they want to hear and what they're willing to consider. Mm-hmm. And then we invite them back about a week later. What we do during that interim period is we try and work the case up. There's a lot of work that goes in, time and effort that goes into analyzing a case from the aesthetic side to the functional side, so that your teeth are comfortable, and also the health side to make sure that periodontally patients are stable, because periodontally things need to be stable before we can go forward with any aesthetic work. So they come back for about a half an hour, and we go over the entire case and give them some options and alternatives.
When most people come back, do they come back with somebody else, a spouse or a relative or something like that?
Yeah, we ask that they bring somebody with them. If there's somebody that that's going to have an influence on their decision-making process, we ask that they come along with them. This way they don't have to go home and explain what I explained to them. Mm-hmm. And if their loved one has any questions or concerns, they can ask it directly of us, because we feel we can answer it better than they can relay it to them.
That's a great idea, because also I would guess, as people start to listen, they get a little nervous. They're thinking about how it affects them. They don't hear a whole lot of what you said. And if they go home, who can they bounce it off as a sounding board? So
exactly.
I think that's a nice idea that you invite them to do that. And for a lot of people, is there just sort of one option, or do they usually have a number of choices to choose from?
No, we give them a few different options and alternatives. And we do a bunch of imaging, so patients can have an opportunity to see what their teeth would look like with one option as opposed to another. And it's quite amazing.
Is that right? I bet you when you can show them a before and after, that's very powerful to know what it's going to be like before you even start.
It really is. And the biggest thing we show them is a lot of our cases. We show them, 10, 20, 30, 40 cases that we've done in our office that are similar to theirs, that they can expect similar results.
One of the reasons I had you on the show is because I've seen your dentistry, and it's really amongst the best I've ever seen. It's just beautiful stuff. So it's hard to show people a picture on the radio. You really can't. So our listeners just have to take that from me.
Thank you.
So you spoke a little bit about the digital x-rays that you have, and I know that your practice has made a huge investment just in technology in your office, again, more than most practices ever do, but it's really in keeping with your line of committing to doing the best and providing state-of-the-art stuff for your patients. And before the show, we were just talking about some of it. So you spoke about the digital x-rays a little bit. You were telling me how you use lasers to diagnose tooth decay. So let's talk about that a little bit.
Yeah, we have something called Diagnose, which is a laser caries detection device. What it does is it detects cavities on teeth, areas of decay, before it can become visible on either an x-ray or it can be detected by a dental instrument. So it gives us a gradation in number. It's numerically valued based upon the intensity of the decay and where it's located. And patients can, it has an audible sound to it, so patients can take part in the process and really know what we're measuring when we measure these areas.
So it's not really so subjective as it used to be. It's more objective now.
Exactly. And if there's something marginal which doesn't meet the criteria of decay, we can, record that number, and then we can follow it up in 6 months to a year and make sure it's not becoming any more elevated where it would require care.
That's great. That's great. I know we're also talking about all ceramic crowns and a machine that you have in your office that actually mills the restoration in your office, makes the restoration that it doesn't have to go to the lab. And I know very few offices have really made that kind of investment. So tell our listeners about that technology.
Yeah, it's really an amazing piece of equipment. It's something that I've thrown myself into. It's called CEREC. It's CAD/CAM technology. CAD/CAM has influenced our world all over in all facets of everything that we use, and it's also impacted dentistry. So we have the ability to take digital pictures of teeth without having to use the goopy impression material, and from that we can fabricate crowns, inlays, onlays, veneers, fillings, all that are digitally modified from a computer. And it's milled in our office by a diamond milling machine. Once everything is complete out of the milling machine, it's tried in. If it fits perfectly, it goes back upstairs where it's stained and glazed, and it is as good, if not better, than what we can get from any dental lab. So it's really phenomenal technology.
Well, it sounds like it saves the patients a lot of time.
It does. There's no requirement for a second appointment. You don't need to wear a temporary. If it's a crown procedure, you don't need to get numb a second time. A lot of our patients live in Florida.
I bet people really appreciate that, huh? Not getting really numb that second time.
They really do. They really do. So it's a great service.
Wow.
And a lot of our patients come from quite a distance, so they make a long travel to us sometimes, and it's not easy for them to get to and from our office. So to be able to get things done in one appointment really is a big help for them.
Wow. How long does it take the machine to mill those restorations?
Like a typical crown, it could take anywhere between 4 and 7 minutes based on the size of the crown. So it's
7 minutes.
7 minutes.
And it's ready to go.
It's ready to go.
That's amazing. As where before it used to be make a temp. What was the old process like for people who don't know?
Yeah, you would have to make it temporary. It would be cemented. It would go off to a lab, and then from there you would be seen 3 weeks later, where it would be tried in, and you would hope that it fit properly. Now we know in 7 minutes if it's going to fit perfectly or not. And if for some reason there's any discrepancy, we can simply take new images and have another crown or restoration milled within another 7 minutes.
Wow, that's amazing. So none of the worrying about your temp coming out, not being able to chew gum, or all those things.
No, you can pretty much eat on it instantaneously as soon as it's bonded in place. So it's really a great service.
Wow. If someone took this machine away from you, would you be able to function now?
It's funny. A friend of mine asked me that about 2 or 3 weeks ago, and it's changed the way I do dentistry entirely. So I would probably, I don't know if I retire. I'm too young to retire. But it wouldn't put me in a great state of mind. So it's really a phenomenal thing.
What do patients say? I mean, I would think as a patient, they see this kind of technology. What do they say to you? Can they watch their restoration being made?
We actually mill it. We actually design it together, and then we give them a tour, and we walk them upstairs where it's actually milled, and they actually load their block into the computer.
Oh yeah.
They're able to watch the tooth be milled by the chamber, and they're amazed. I had one gentleman who was actually filming it on his iPhone.
Is that right?
Because he wanted to show his wife and his daughter how amazing it was. So. It's really great technology. It's unbelievable how advanced it is.
Aside from the time savings, which is tremendous, and aside from the savings to the patient of not having to have another numbing episode and all that goes with it, but why are these restorations better, or are they better than, say, the old silver fillings that used to be put in?
Yeah, the restorations that come from CEREC are all porcelain restoration. So the newest product that's on the market is called Emax. It's extremely strong. It rivals that of any material that was used over the past 25 years. And the beauty of it is that it's bonded in place. So whereas silver fillings are wedged in place, they can break teeth subsequently if you're rough on your teeth, if you chew ice, if you chew hard candies. Whereas these actually unite the tooth surface and they distribute the forces much better. So in the end, they look gorgeous. You can't tell anything is on your tooth, and they're functionally, the strength of them is it's unmatched to anything else that's on the market. So
really it's like a horse and buggy to the Concorde,
exactly,
in terms of restorations. Wow. Why doesn't every dentist have technology like this?
I think the cost of just implementing that into a practice it's cost prohibitive. So, in our practice, we're real progressive. We have 4 doctors, so we're able to, go
really
over
use
and
the
above
machine
and really utilize it to its advantages.
Wow, that's great. That's great. What other technology do you have? Anything else we didn't touch on?
more than, we have a lot of intraoral photography that we use with intraoral cameras in the hygiene rooms. Myself, I tend to like the digital SLR cameras. We can get some great photographs of teeth and really demonstrate. They say a picture is worth 1,000 words, and I'm a true believer in that. So the biggest thing, what we touched upon, the CEREC and the photography and the digital laser detection devices, and
it's like Disneyland, Disney for dentists. How when we talked a little before about these complicated cases, I just want to get back to that for a minute. As you were talking about it, I was thinking that people's cases probably get complicated many times because they haven't been to the dentist in a long time, and we spoke about some of those reasons. But when people come in and they haven't been to the dentist in a while, are they ashamed? Do you think there's like a shame element that keeps people away from taking care of their problems?
Yeah, I think that there is. And the biggest thing, the last thing I ever do is pass judgment on somebody as far as why they haven't been to a dentist or what, why their reasoning is for being away for a period of time. And I try and really establish a good bond with them. And after the first appointment, they really realize what our practice is all about. And those beliefs and emotions, they really go out the window. And they become dedicated patients that are really involved in their investment to achieve dental health.
I like the sort of that you use the word investment. So, we spoke about maybe, the fear of the unknown. That probably keeps people away. There's probably just the fear of discomfort and the fear of the cost. So let's just talk about how your office addresses keeping people comfortable, because I'm sure that's a big reason why a lot of people don't go to the dentist.
As far as cost is concerned?
No, comfort.
Comfort. Yeah, in our office, we like I said earlier, is we always try and treat others the way we want to be treated. In our operatories, we have DVDs, we have massaging chairs, we invite patients to utilize our iPads in all of our rooms. We have warm towels at the end. Anything we can get coffee, drinks. I bought lunch for patients who are there for extended periods of time for longer cosmetic cases. Patients that are in long cases as well, we get ice cream for them upon termination because it's easy to eat.
Do you ever have you ever really run across a patient that you couldn't get numb, or do you find that with your advanced techniques that when you're using Novocaine you can really keep people completely comfortable? Yeah,
the newer anesthetics are amazing. The anesthetic is profound. The only complaint we get is that they're numb too long, too after.
Oh yeah.
I've rarely found that patients can't get numb, and it's never an issue at all. And then now there's a new reversal agent for those patients that don't like to be numb afterwards that we can give them that really counteracts the anesthetic. So they leave and they go home and they're not numb anymore within 15 minutes. So it's...
And for the person that's listening, that's really concerned about the cost of dentistry, because, really dental insurance hasn't kept pace with inflation for the last 30 years. So whether people have insurance or don't have insurance, really insurance takes care of so little that it's almost meaningless. So how does your office handle that with people?
Some of our patients do have insurance. About half of our patients do, and I tell them that's a gift, and they got to look at it that way. For those patients who are financing their dental care on their own, we have a lot of third-party lenders that we've partnered up with in our practice that we can extend out their payments over a period of time so that it's suitable for them and that it's feasible.
So the average person doing these big cases is really the average person. They're not, the wealthy oil sheiks coming from Saudi Arabia to Massapequa.
No, not at all, not at all, not at all. And then they pay out over time to the point where they feel they can, so that it doesn't impact their lives, and it's something that they can afford.
It's funny. People fit vacations into their budget. They fit nice TVs into their budget. They fit boats, all kinds of things that are important to them. And I guess when people feel important about their teeth, they find that space in their budget for the other things that have value in their life.
Yeah.
That's terrific. So just to wrap up, maybe you could tell everybody where your practice is, how they can get in touch with you if somebody wants to call you.
Yeah, our practice is at 101 New York Avenue in Massapequa. Our office number is 516-798-4223, and our website is www.greaterlidental.com.
And when people call, can they ask just for Dr. Woltman, or do they just get whichever dentist is available?
For the most part, a lot of patients, if they've been referred by others, they would ask for one of us in particular. But whoever's hours fit your schedule the best, that's what I would recommend. Or if there's a particular need that you have, they would direct you to the doctor who would be best suited.
And if you're in our final 30 seconds, if someone's listening at home and they hate their smile and they've been waiting, delaying, finding every reason in the book not to call, hesitant, what would you say to those people?
at least come in and we always invite patients to come in, and it's a free consultation. Let us just take a look, and we'll give you an idea. We'll just tell you we'll take a couple of pictures and show you what we can do, and if it's a match and you're happy where we are, and we would hope we can help you out.
No harm in asking, as my grandmother used to say. Jim, it was a great show. Great. Thank you for being on tonight. I really appreciate you taking time to talk to us. I'm Dr. David Scharf. You've been listening to Healthy Living Radio. We'll see you next week. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.